But I saw during the COVID times that there was active censorship going on. The definition of vaccine was being changed, that the definition of anti-vaxxer was being changed in like in reference books. There were some physicians who were the enforcers against free speech, which was really frightening too. Why isn't the public health complex in America and certainly in Los Angeles where I live, why aren't they implementing those public health principles of public health ethics that I learned? Like, this is unethical. So you're going to deplatform some doctors or some citizens because they don't agree with the CDC or the World Health Organization because the CDC is always right or the World Health Organization is always right. And I was like, this is dystopian. This is ridiculous. And we also learned this in medical school, Randy, right? Sometimes the wisest thing to do is to do nothing for the patient. Even if the patient wants you to do something for them.
Today, we have the brave, intrepid woman of integrity, Azadeh Khatibi. I mispronounced it. I said I was going to get it right. Azadeh Khatibi,
Very
doctor,
good. Wow.
ophthalmologist, MD, MS, MPH, and we're honored to have her on our show. And she was part of the impetus in getting rid of some of the intrusions to medical freedom and what I would call medical speech. But Azadeh, can you tell us a little about your story, how you wound up taking this role, and what's that been like for you and for us as well?
Thank you so much, Dr. Bach, for having me on your show. I really appreciate it. And I hope that I deliver something of service to your audience in telling my story and the story of several doctors who joined me on this path. And also the larger sense of some doctors who were speaking up, especially in California during the COVID times. I certainly didn't expect to be in this position or in this role where I become a medical freedom and a free speech advocate. I My name means freedom. Azadeh is Persian for freedom and liberty. And I always wondered how I would step into that role. I always felt that, and that's something in my personality that I've always wanted to promote, this sense of being free and freedom in our society and within myself. But it really came to a head during the COVID times when the medical field and physician autonomy and patient physician relationship, especially in California, was really under attack. And actually, I saw even some of my own colleagues were as physicians, were the enforcers of promoting dissident voices from speaking their own ideas and their perspectives. Really, it's the opposite of what the scientific process should be. So I'm happy to talk more about that if you'd like. And Well, I'm trying to think about the concept of the sacredness of the patient physician relationship and how that's being dissolved, especially in the past several years, with having this governmental and corporate entities having incentives really to come in and uh, stoke the fire that put patients and physicians at odds in some ways. And this is when I talked about there were some physicians who were the enforcers against free speech, which was really frightening too. But yeah, and there's also this concept of like public health. And I remember thinking about this when I was studying public health at UC Berkeley, because I also have my public health degree in addition to my medical degree, and seeing that, oh, what are the values and the incentives that promote the unique relationship between the patient and the physician. There's things that are at odds when public health comes into play, because the public health view of things is really looking at society and populations as a whole and does not hold that individual sacred. And so public health and the individual patient physician relationship can sometimes be working together, but sometimes they can be very much at odds. And I think it's very important for us to be able as patients to have consulting physicians who have our best interests at heart, because that's really what's going to help our bodies, our minds, our spirits feel completely, be on that path to being whole and feeling safe and feeling heard and feeling like someone really has our back. But I mean, even during COVID times, I myself, I had my doctor, one of my children's sons, sorry, one of my son's doctors shouting at me in the hallway in front of his other patients, in front of the waiting room, right next to the waiting room, in front of his uh, uh, people who worked for him, talking about my private health or my son's private health information and shouting about it with regard to the COVID vaccine. And I was just like, I'm a fiery person, but up to that point, I've been very, very calm and I stayed calm. And I felt that he was really thinking what he was doing was right, but it had gotten completely dysregulated. And I remember telling him, "Why are you shouting my son's health information for everybody to hear?" And he's like, "Oh my gosh, you're right. You're right. When you're right, you're right." And I didn't report him to the medical board, but I was just like, this guy is completely lost. He's lost the script of how you're supposed to be as a doctor. And because he was so afraid, and I had to tell him, kids are not dying at large numbers that are healthy.
Or any numbers, frankly.
Right. And the kids who are dying, at that point, he'd been talking about the kids who had died at Children's Hospital in Southern California. And I said, if go and look at it, I told him, I said, you don't have the complete picture. These kids had comorbidities, not that their lives are worth any less than any other child. Actually, we should have been doing a lot more to protect the vulnerable populations. But he was just lost. He had lost it, and he was living on this fear path. And so the relationship between me, the patient, or my son, and the physician that I was supposed to trust was completely uh, dissolved.
Yeah, no, I agree. Two separate things, but I'm going to maybe come back to the first question later. But public health. What does that really mean? I'm going to spare that question, but I just have a quick anecdote while you're talking about what you said. Brought up a situation somewhat analogous. I play squash and tennis, and I was sitting during the COVID years, but a little quiet part of the COVID era. I think late it's been early 2021 or something like that. There wasn't really much illness going around. Everyone's kind of doing their lives, but doing all the formalities, masks and whatever. On the squash court, at that time, there were no masks. The child, 11, 12 years old, was taking a lesson with the teacher. And I had just finished my game on the next court. And I'm just sitting on the couch and I'm talking with the mom / caretaker of the child. And very kind of acquaintance level, not big friends, but I was just exhausted. I kind of plopped myself down nearby, not too close. We wound up chatting, and I don't know. And she knew I was a doctor. She was asking about the vaccines or what, all this kind of stuff. I said, well, I just think that there's not enough runway to know whether they're safe or not. And kids, don't really get issues with this. You know the whole drill. and this girl had already had the COVID, illness, whatever, the year before. And I said, if it were my kid, I probably would just wait. I mean, it's like she's healthy. There's no real benefit to her. She already had the illness. She has immunity, blah, 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 etc. You get the idea. And like a scene like Superman, like popping in. This guy, his self-conceived Superman, he had the initials also. You got the MD and the MPH. I found out later, and I never really, talked to him. I knew he was at the club. He kind of bursts onto the scene and starts screaming at me. Like Invasion of the Body Snatchers. He's pointing at me and screaming at me. How dare you? And he starts yelling, "You're endangering the world, da, 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 and you have no right to do it." I'm like, dude, do I know you? Like, what's going on? And so he just literally was on like a 12 out of 10 scale. He's just like his, smoke coming out of his ears practically. And I had to like get him into the office, sequestered, close some doors, and say, look, let we should probably put this, online. If you have questions about my integrity of my message, put them in questions. I'll answer them. You're like too way overboard for me to deal with. I can't have this yelling. I don't think it's safe, for that child, whatever, to hear this kind of stuff. Whatever. If you want to talk with the mom, you can do that on your own. I was having a private conversation, blah, blah, blah. And I didn't even know the girl's name or whatever. It was all just kind of on a very general level. I wasn't telling her what to do, all this kind of stuff. I was just saying what I would do with my child if I had an 11-year-old at that moment, which I didn't. And I've had children before. My children are old now. But anyway, so we exchanged a couple emails back and forth. And that was that. He never really followed up. I've in the aftermath, when, no offense to him, but I've been proven right. He's got the, more initials after his name. I only have the little couple of them over here. But, it's like, it's his is bigger than mine, but, I was right. And it's just kind of like, you don't get any apologies. You don't get any retractions, reformulations, revisions, regrets, anything. And it's just kind of an annoyance. Anyway, so coming to my first question, second, you feel free to comment on the anecdote, but what is public health? How do you learn it? What messages have you kind of brought to the fore, and how did COVID play out in a public health sense, and what is actually what's it all about? Tell us.
Well, to answer that question, I will go back to why I decided to get a public health degree in the first place. So I was already in medical school and learning about how to take care of the individual. I'm a very curious, intellectually driven person, and so I
You
was
want the truth.
and I wanted to learn why. Okay, I'm learning what's going on with how to take care of this patient in front of me, their heart attack, their eye problem, etc. But what about why this patient got this problem in the first place? I'm not learning that in medical school. I mean, you're learning a little bit about it, but I wanted to think about, like, how are these large amounts of people getting heart attacks? Why? And how do we prevent that? If so many people are getting them, like, how do we start preventing them? And that's what made me want to, and how can we help on a larger societal level? And that was what drove me to get my MPH, to understand these things and the larger picture of it. And so I went and got my public health degree. I got it from UC Berkeley, one of the top public health schools in the nation, which really disappointed me, and continues to disappoint me, unfortunately, in terms of how they view how political they've gotten sometimes with regard to public health and the political stances that they've taken, and the tribalism that they've promoted. But in any case, I went and I learned about uh, looking at studies, population-based studies, problems with that. I learned about public health ethics, and I was in an interdisciplinary program, so I don't know if everybody learned that, but I hope they did, about how in the past people have gone and we've implemented public health programs in other nations, for example, or in certain communities, and it's been a very top-down approach, and how that's wrong to do. How you actually need to listen to the population upon which you're doing this public health intervention. You need to listen to the stakeholders and listen to the people and have cultural competency and understanding about their beliefs and belief systems and the desires that they want, and not just implement the program on them and force it on them. That was like a lesson that heard over and over and over again. And yet, during the COVID times, I was just like kind of flabbergasted, like, wait a minute, this isn't what I learned in public health school. Why isn't the public health uh, complex in America and certainly in Los Angeles where I lived? Why aren't they implementing those public health principles of public health ethics that I learned? Like, this is unethical. Um, for example, in Los Angeles, Barbara Ferrer, who's the head of public health here, uh, I think what was not said was that because there were certain people that they were because there were certain populations, minority populations that were dying at higher rates, they kept promoting lockdowns on everybody, everywhere in all of the city because they believed lockdowns helped, and we can't just lock down the minorities in these certain areas, so we have to lock down everybody, right? Shouldn't have locked down anybody, but any case, it just was just weird, unethical, political maneuverings behind the scenes that what I had learned in public health school was not really supposed to be what you were, how you're supposed to be practicing it. Um, and then understanding another thing that I learned in public health school that I didn't necessarily learn in medical school was understanding how people become ill. And one of the things that stayed in my mind was the studies that looked at Japanese immigrants, third generation Japanese immigrants from Japan, 3 generations later in America. They still married Japanese people and procreated with them. But within 3 generations, their heart attack rate is the same as the general population in the United States, even though they're genetically still, pure Japanese. And that was like the power of the environment and the environmental factors that affect our health. Um, that was something that I learned in public school that was really, really powerful. And when I was looking at how the public health apparatus in the United States during COVID was not implementing this knowledge uh, in terms of their public health intervention, that was another big red flag to me too, because especially after I've gone through a serious illness myself, understanding the role of emotional well-being, understanding the role of our diet, understanding the role of exercise, understanding the role of healing the body, not just by having a pill that you take, I didn't, or a vaccine that you take, in this myopic focus, but looking at the body as a whole was something that I felt like, again, I learned it in public health school, but the public health apparatus was not doing, but they were just solely focused on myopically, like hammering down on a virus. Basically what I saw, especially in 2020, was just a complete failure of the public health apparatus in the United States and in my state of California and in my city of Los Angeles to really address root causes and to look at downstream consequences of all interventions. Scott Atlas, I remember very early on, within a few months of the pandemic, was talking about his analysis of the disability adjusted life years and quality adjusted life years with lockdowns and kind of these uh, draconian interventions, and how long term it was going to actually cost. And again, this is something I learned in public health school: quality adjusted life years, disability adjusted life years. How these which is basically applying an economic uh, factor and assigning a number to a certain lack of quality in one's life or a certain disability in one's life. So if you, for example, take away a certain number of years of education for a person, economists have kind of figured out that that ultimately is going to affect their ability to make money. And we actually have realized that it actually causes a reduction in mortality. Or excuse me, an increase in mortality. So you theoretically die earlier. And so then what happens if you've locked a child down from school? Then that ultimately is going to reduce their economic viability, and it's going to increase their mortality risk. So again, this is something I learned in public health school, that it's important to think about these things and the downstream effects of every intervention you make. And there's a wisdom. And we also learned this in medical school, Randy, right? Sometimes the wisest thing to do is to do nothing for the patient. Even if the patient wants you to do something for them, you can write down in the chart, patient, says they're going to leave my practice because I'm not giving them X, Y, and Z. I've explained, the risk, benefits, and alternatives doing X, Y, and Z, and I've explained that I'm not going to do that for them. And so you end up having patients go doctor shopping, which is a problem. But the ultimate idea for me is to like have a wisdom about when should we intervene, how we should intervene, what are the consequences, the long-term consequences of intervening, lockdowns, masking a 1-year-old or masking a 2-year-old, vaccinating a child under an emergency use authorization. Like, what are the downstream consequences? I was flabbergasted some of my physician colleagues weren't doing things. They just weren't. And I was flabbergasted that the public health apparatus and our government wasn't thinking of these things.
No, it's a huge sadness overall. There's an it's not my term of art, but somebody came up with this concept when liberal pieties collide. So liberals have certain beliefs, and we love them for their earnest, forthright caring and whatnot. But sometimes you believe this, and then you believe that, and those things wind up colliding. And so the nice example, kind of ironic example, was what you were talking about for a lot of Los Angeles or city or county efforts somehow being kind of over draconian in order to help the most the lower classes, say people of color, whatever you want to inner city, blah blah blah. But the irony in New York City, the way it played out was people had to have these vaccine cards in order to enter a restaurant or whatever, and the more vaccine hesitant part of the population was that same population, and whether that emanated from the aftermath of Tuskegee experiment or just kind of a general kind of skepticism of the goodness of government or whatever, having been historically say more marginalized, whatever. It's a funny thing that the people who didn't have these vaccine cards to get in were more of the minority. So it became kind of a Jim Crow era incident where the blacks and Latinos, but principally the black population in New York, was less likely to have an ID card to get in a restaurant. So they're doing kind of a racial, by proxy, a racial segregation, and that caused its own issue. So it's like, oh my God, now what do we do? And so it's like, oh, we want everyone to get vaccinated, and we also want to like care for these populations, but then we want to, so it was kind of like a mix of, and I think at the root of all of this was its own kind of, safetyism. I think that there's a real divide between what I've had recent on my show, David Goodhart, who's a UK editor and writer and whatnot. He has a book, but anyway, he divides the world between the anywheres and the somewheres, or the any place and the some places, whichever the term is, I forget. But the anywheres or the any places can work anywhere. They're the laptop class, and they are able to kind of glide through the pandemics. They can do their Zoom calls. They can do things remotely. They have PDFs. They know how, whatever. They've got all the facility, all the education. They've got the letters after their name, and they can do all that stuff. And the some places, they're the plumbers, they're the delivery people, they're the orderlies, they're those people who have to show up because they're maybe not be on a regular day, they're not considered essential, but on a day where you just kind of want to be at home and be, they're basically like the feudal class, the serfs, and not just serf but serving, and not just feudal but futile, because you're kind of like getting to have your monarchical regal kind of life and being catered to and have your Amazon stuff dropped off one way or another, and everybody else has to kind of like suffer through it, and they get to do all the exposures that you're willing to put yourself away from. And it takes kind of the correct soul, in a sense, in order to see through that chicanery, that flim-flammery, that kind of sabotaging of morals. I mean, there's a concept, noblesse oblige, which is that the people who are noble, the royals back in the day, they had an obligation to their underlings. They were not supposed to just step on them and work them over and whatnot for their betterment. That really the concept was noblesse oblige is like you do it because you can. the whole concept of the liberal arts, was actually what the term liberal originally was. Was in the essence of freedom. The liberal arts were there so that you could be, smart enough to understand how to preserve liberty, and maybe not just for only for your class, but try to promote liberty. Now, the Romans had slaves and whatnot, and slavery's been around, and only till the last like 150, 200 years or whatever. But before that was the kind of the root operating system of humanity, is to have slaves and to rape and pillage and whatnot, and war. Now we're supposed to be beyond that, but in this case, we wound up having this class system put on, and so to that end, it seems like a lot of this stuff was a lot of the laws and constraints, whatever, for this laptop class, the anywheres, in order to kind of like rule over the somewheres. And it's just like it's a ruler underling dynamic. But you fought against it. You have a lot of letters after your name. You have the ability to kind of lay back and just absorb and kind of hang out, presumably. What motivated you? What was the kind of the internal moral motivation that keeps you going for this?
Well, I guess I've always been an idealistic person. As I've gotten older, that idealism has been tempered with some rationalism. But I certainly also, I'm a fire sign, so I'm going to be more of a fiery personality. And so that's going to drive me forward to speak up. From an Eastern perspective, my throat chakra is quite open. So this is kind of my personality. Um, and doing good as possible, for one, because the world is imperfect and this physical existence is imperfect. So, and what you think might be good in the long run and the big picture maybe may not be, but right, you just see whatever you see and you try to be open and you try to kind of align yourself in mind, body, spirit, and do what you think is the most appropriate for the situation in front of you. That doing good or taking the right step forward has always been important for me. Truth has always been important for me. Freedom has always been important for me. And then having that medical education, having that public health training, and seeing how public health was really being twisted during COVID times and not being followed in terms of what actually we were supposed to be doing, in terms of the principles of public health we had learned. Um, and seeing that we were just, from a policy perspective in public health, ignoring uh, uh, environmental factors as they promote disease, as well as pursuing this dogged vaccination and lockdown agenda to the point that we were censoring Americans, we were censoring doctors, we as being the government was pursuing the deplatforming of anybody who didn't agree with their narrative, beyond just suggesting to a social media company, hey, we disagree with this speaker, but saying, if you don't agree with deplatforming this person, tech company, we're actually going to go after you. And having those threats veiled, possibly, but certainly the threat is there under certain laws where the government can make the tech company, and I've forgotten the section it was. I think it's like section 236. Don't quote me, but there's like a section where the government can start taking more and more control and having more requirements for social media companies and having them kind of have to be, you know what? I'm not going to say because I've forgotten what the details are. But there's something where there's the veiled threats that if they don't meet certain requirements, that the government can hold them to higher requirements. And so the requirement for them was, you better participate in deplatforming these people, or else we're going to come after you. And that's frightening to me, especially when I heard, I think it was like somebody CEO or somebody of like Facebook or someone say, we are going to follow CDC and World Health Organization guidelines when we're determining who to deplatform. And I was like, this is dystopian. This is ridiculous. So you're going to deplatform some doctors or some citizens because they don't agree with the CDC or the World Health Organization, because the CDC is always right or the World Health Organization is always right. Like this doesn't make sense. Doesn't anybody else see this? Doesn't make sense. And so there was this fear component. And then once I let go of, I kept working on letting go of that fear. And I started speaking out in early 2020, and or like spring 2020. And as I worked on and I tried like the normal channels. I remember writing a letter to the New England Journal of Medicine with a colleague of mine, talking about how vaccine mandates were not going to be. It was in response to another article that was like creating a framework for vaccine mandates, by some pro-vaccine ethicists, because there's different camps, and there's always been. There's like the pro-vaccine ethicists, and there's the the pro mandate ethicists and the anti mandate ethicists. And they, always discuss. But then during COVID, for some reason, like the voices of the pro mandate ethicists became much stronger. And so I was kind of speaking out against this, because from an ethical and bioethical point of view, for me, mandates just don't make sense, because bodily autonomy is so important. And the government telling you what to do with your body and kind of coercing you, with threat of losing your job, which ended up happening, right? Like the government said, if you don't, told companies, you're not going to get government contracts if you don't have a vaccine mandate for your employees. Like that's just, it is, we reached the dystopia.
I draw the line here. Michael Knowles, I listen to, he's got a podcast. He's with the Daily Wire, and he points out the root word of public, as in public health, and is publius. It's the same root word as politics. And so this is kind of a political application of health. Now, can there ever be mandates? Well, in certain circumscribed conditions and situations, there can. He points out, originally, the word vaccine is from vaccinia, which is the cowpox. And cowpox was inoculated as a milder version of smallpox. So when George Washington was garnering his troops in the war for American freedom, the Revolutionary War, he forced his troops to get this vaccinia inoculation from. The term vaccines hadn't come about yet, but they got a little bit of cowpox, and they popped it in on the shoulder as a way so his troops would be ready to weather the storm of potential smallpox, and stay healthier. Okay, so that's a mandate, and that precedes the forming of the American Constitution 13 years later, and so forth. And it was a long war, and it was bitterly fought, and all that kind of stuff. And there were lots of deprivations. When you join the military, you may have to take an anthrax vaccine. You may have to take this and that. If you're going to go fight in West Africa, you might need a yellow fever vaccine, and they can mandate that. That's perfectly okay. That's part of the job. So in certain situations, now, and the second aspect would be if the illness that affected so in small populations, small groups, yes, there can be mandates, but you're part of that. You joined the military. But in larger groups, it should only be if my mythical zombie apocalypse virus came along. If the zombie apocalypse came along and there was some little thing that was going to turn everybody into a zombie, well, then theoretically you could mandate that, so that none of us are safe unless we're all safe. That might be true if we're in a zombie movie, but there's a line between zombie movie and the common cold, and there's a line between a zombie movie, and even a bad flu. And there are lots of things you can always wave your arms and yell about that might cause issues one way or another, and they don't fall to the level of zombie apocalypse.
Well, in the media, it was certainly sold as the zombie apocalypse, and I think that was one of and even by our president, right? It's going to be a winter of disease and death for you if you're not vaccinated. So, they sold it, maybe not the zombie apocalypse, but near zombie apocalypse like. So there was a lack of integrity and a lack of truth and a lack of knowledge and awareness, let's say, even among the media and the president and the government. So if you're selling it like that, and that's not the reality of how things are, there's already, there's no way you should be mandating anything, because you're not you're not an entity that's acting with an integrity and knowledge. Number one. Number two, during the time of the smallpox debates, and there certainly was a lot of controversy about whether people should be vaccinated against smallpox, it was not a requirement for the whole population. Now, for some reason, several hundred years later, we're saying it should be a requirement for the whole population, even though smallpox was so much more deadly for the whole general population than COVID was. I don't remember the exact death rate. It was like 30% death rate or something like that. They still weren't mandating it for everybody. And yet somehow we're supposed to think it's okay to mandate the COVID vaccine or any other vaccine that does nowhere near the mortality rate that smallpox did. That's number two. Number three, when George Washington was vaccinating or requiring mandating the vaccination of his troops, these were not like troops that are living under the conditions of our wonderful military in the military personnel in the United States. They were sleeping on the ground without bathrooms, in poor hygiene, right next to one another, very close to one another, in tattered clothing, without sanitation, without cleanliness, and it was a completely different situation. And so you're going to catch it very easily right next to each other. And there were no ICUs back then. Medical training or medical interventions was at such a different level than we have now. So really, we're comparing apples to oranges if we compare COVID to smallpox. Oh, and another thing, that was an inoculation. The smallpox vaccine was an inoculant. It was inoculation. That is not the gene therapy that is being administered under EUA to people now. So it's completely different. Representative Dingle in Congress declared regarding mandates. By the way, she apparently had like 20-second opinions regarding whether or not she should get the vaccine because she'd gotten Guillain-Barré from one of the previous vaccinations. She said, if it was good enough for George Washington, the mandate, it's good enough for me. Like, that is just ridiculous. She was comparing apples and oranges. So that's what I have to say about it. If you can have an entity who's a governmental entity who's acting with integrity and in truth and with knowledge, and you're dealing with zombie apocalypse, that's one thing. We can talk about it. We can debate it. Even then, we have to look at, are the people who want you to get vaccinated, are they acting in truth and integrity? Are they in mind, body, making their health as excellent as it could be before they force you to do something to your own body? Right? Because if someone's like, well, I want you to get vaccinated, but that person is not exercising, they're not eating well, they're not getting their sunlight, they're not dealing with their childhood wounds and dealing with their high cortisol levels that's causing them stress and problems and a depressed immune system, but they somehow expect you to be like for vaccinating yourself, even if you don't want to protect them, that's a huge problem in my book. So that's what I have to say about vaccine mandates. But in any case, for me, what was important for me during the COVID times was to hear different perspectives. I am very open and I learn from hearing different people. But I saw during the COVID times that wasn't happening, that there was active censorship going on, that the definition of vaccine was being changed, that the definition of anti-vaxxer was being changed in reference books. And so that also, again, talk about acting out of integrity, changing the definition of words to suit what the governmental propaganda or what the governmental narrative is. Or what like you think is the appropriate way for people to behave. That's frightening as well. So when I saw this stuff, and then I saw in California, the legislature had this vaccine working group made up of some doctors and some non-doctors that was creating a group of bills that went after that was promoting vaccine and was promoting the COVID vaccine for all school children. And then there was another bill that said any doctor who speaks out against consensus in California with regard to COVID can get their license investigated or taken away. These all made the hairs on the back of my neck stand up. And I started with the normal channels. It was like, let me meet with my representatives. Didn't really get anywhere. And then I started speaking out on Twitter, and I went from something like 12 or 20 followers to like 1,200. And our mutual, my dear friend, I know you've interviewed him as well, Dr. Bach, Human Hemati, I texted him and I was like, what should I do? He's like, get on Twitter. We're doing something on Twitter. I was like, okay, fine, I'll get on Twitter. I started tweeting my beliefs, and using my voice, and got a big following pretty fast. And it was just by speaking my truth. And the more I did that, the better I felt, because you're here on this earth, from my view as a physician, it's to manifest your inner purpose. And when you don't do that, there's an element of like mental, emotional, and physical unwellness that happens in the body. And the more I did that, more opportunities came, and I had the opportunity to be involved in a lawsuit that went after the AB 2098 law that said any doctor that doesn't follow consensus can get the license taken away. And we sued in court with the help of the New Civil Liberties Alliance, some other doctors, and I'm making a documentary about our journey through that. And uh, we put so much pressure, and it looked like they were going to lose in court, the government, the state. We put so much pressure on them that Gavin Newsom went up actually to my friend Dr. Hamadi, and he said, it was my idea to repeal the law. They ended up repealing the law, and he took credit for it, to my friend. And because I know he knew that the censorship law of physicians in California was going to make him look bad for his presidential ambitions. And it was really a testament to just standing up. Even if you think you're going to lose, there were times when I thought, oh my God, how are we ever going to fight this? We're going to have this like word consensus looming over everybody's heads as a doctor. If you don't follow consensus, who's setting the consensus, right? Is it informal consensus? Is it formal consensus? I mean, even as a physician, I've gone against formal consensus multiple times, and I've been right for myself and for my patients. And eventually the consensus changed. And so then they agreed with me. And so it's like, well, that's why we need to make sure that doctors, as long as they're behaving appropriately with some scientific, rooted in some scientific backing, that they're doing the right thing for their patient in front of them. And we shouldn't be trying to legislate their behavior, because that becomes very dangerous. We saw that in World War II. Where the government interfered with medicine. We saw that under Stalin. This is not the path you have to go on. We need diverse opinions. We need diverse views, and that's how medicine is advancing. And I was really, really happy with the results.
No, that's excellent. The AB 2098 is, when you're talking about Gavin Newsom, I saw a clip. He apparently prettified San Francisco for the G20 meeting, or one of those things, and somebody said, didn't you just do that? If you could keep the city clean just with a stroke of a pen or a mandate, whatever, why don't you do that all the time? And he says, well, you might think that I had the city get cleaned up for this meeting, and you'd be right about that. And if you think that it was a matter that I wanted the place to look good for them and not for you, well, I guess you'd be right about that too. I mean, it was, kind of like this weird candor. He's somebody who got burned for, the kind of Boris Johnson aspect of partying while Rome burned kind of thing. He was at the French Laundry having his, sounds like a place to get your clothes done, but high priced venue overlooking the Pacific or something like that. And he was partying without masks and all that kind of stuff, all these mandating for everybody else. It's one of these, someplace kind of dichotomies where any places do what they want, and if they don't really treat these things seriously, if they really cared, it's like when Barack Obama, his major properties outside of Chicago and DC, and those are at sea level also. He's got one in Hawaii and one in Martha's Vineyard, Martha's Vineyard was like literally on a marsh. If he cares so much about the rising tides and sea levels and whatnot, he wouldn't put his own money there. And this in economics called revealed preferences. So you can say anything you want, but where you put your money, what things you buy, things you do, that's who you are in a sense. So I can say, like Bernie Sanders can say he's all about the people, that he buys 5 houses. There was a meme I saw recently that, it was a group photo of all the people Bernie Sanders has ever brought out of poverty. And there were 5 pictures of Bernie Sanders. He's done very, very well. He managed to leverage his political campaigns. He, got bought off by Hillary to drop out. He got bought off again in 2000 to drop out. So his dropping out is, managed to drop in a fair amount of coinage. And a lot of these things just wind up, having a money trail. The kind of massive defraudment of the taxpayers through the USAID, is emblematic of all these things that are under the rubric and the titleage and emblems of doing good Most of the time, all these things, 95% of them wind up doing good or doing well for that person's own bank account. The Clinton Global Foundation has been very good for the Clintons, and they wind up, taking that money and leveraging it in other ways. People are selling favors all the time, and any time somebody wants to kind of do good, it seems like that, numero uno is themselves and their cohort and their class and so forth. And oftentimes the people. So, kind of the sense and sensibility of putting your own interest kind of secondary and working for some places and so forth, in genuinely, not in the Bernie Sanders, kind of misguided, way, which, his desired socialism would kind of leave people in poverty and whatnot, is a blessing and deserves reward and our great devotion and appreciation. So I'm going to give you the floor for another couple of minutes about maybe medicine in general, how this affected us, how what has happened to medicine's reputation. I'll just bring up one side example. I think you and I both write for, I know I do, for brownstone.org. And Jeffrey Tucker is a libertarian, but amongst the libertarians, we have this guy, Nicholas Nassim Taleb, from originally Lebanon, I guess, and great libertarian and a great thinker and whatnot. He's wearing like triple masks on the airplane, and he's like freaked out of his mind. How are you supposed to read any of his writings, which are supposedly hugely insightful? I found them dense and difficult when I, long before this, when I picked his stuff up, everyone said, "Oh my God, what a great, brilliant man! You got to read his stuff. He's got the Black Swan event, all this kind of." Well, here's a genuine Black Swan event, and what do? The revealed preference, not just of things you buy, the way you act, is like, it winds up being kind of a Harry Potter sorting hat to see who falls into which category of believability ultimately. And it's just kind of a weird kind of, episode.
Can you clarify for me and for your other listeners who don't know what a Black Swan event is?
Oh, geez, that's Talib's book. And it's one of these rare things, it's an inversion. In fact, I'm not going to do his economic philosophy, but here you have, it's basically how you're going to, see through, different answers based on circumstance. People misread things, and you're going to find the truth, blah, blah, blah. Like, dude, then what's wrong with your own perceptual aspects? How are we supposed to believe you on that when you act so horribly with this? It's like somebody who's so caring, but you see him out with his own dog, and he's whipping his own dog. I mean, when somebody like is cruel to a pet, you're like, oh, you know what? We can't have them over for dinner anymore. That is kind of like who they are. And it's just, people can philosophize all they want, but when they're, put to the test, if they act so poorly, we can't really trust them.
Right. And I agree with you. And it's in terms of how can you trust someone when they're showing you who they are, through their behavior in ways that you don't respect or agree with. I think ultimately what I come back to is that everybody is fallible. Nobody really has the answer. There's much more we don't know than what we know. Living by principles, is that more of a Stoic philosophy? But living a principled life, I think, in terms of just following through with your principles, or leading an organization with principles in terms of truth, integrity, and being open, the principle of being open and understanding and being humble. I think that I tend to respect people who live with a principled way of life. And I think that's a good way to see if people are doing that. When you talked about the Clinton Foundation or Barack Obama, et cetera, that's like obvious that they're not, if you're following the principle of truth, for example, well, if you believe in this truth and you're espousing it, then why are you doing X, Y, and Z? And to kind of judge people in that way, like, are they living life according to the principles that they're espousing? And that's, and also understanding that there is no perfection in this world. I talk about like being, taking care of my mind, body, and spirit. At the same time, there's days that I don't exercise, and I wish I would. I'm like, oh, I didn't exercise today. I kept putting it off. And then by the end of the day, I didn't do it. Right.
Well, you got to forgive yourself for that. You look great, and I think your philosophy is clearly played out in your own revealed preferences. I was watching one of your videos, and I saw on your shelf you had the eating from your garden or something like that, and I try to do the same thing. I've planted a few sausages, and nothing grew, so I'm left with vegetables. I was going to plant hamburgers, and whatnot, but
That has
I
been
actually
for you.
but I actually feel pretty good about the garden because I've got a bunch of stuff year after year. I've got a bunch of stuff growing.
Me too.
I
Me
actually have a
too.
plant named after me, bok choy. I usually grow that. Um, so there's actually a fair amount of amusement from the garden. I found it, an interesting diversion. It has nothing to do with our show today, of course, but I think it's all worked out for you, and I want people to be able to find and learn from you, and follow you on X, and you have a Substack as well. Um,
I do. I have a podcast called Within with Dr. Azadeh Khatibi, MD, MS, MPH. And right now, I'm focusing on this another lawsuit that we have against AB 241 in California. They're mandating the speech of doctors, not just with regard to COVID, but in this case, it's implicit bias. But we're on appeal, and we've appealed in a federal court, and it doesn't look so good. It looks like the federal court, appellate court, thinks that. Um, the government can mandate the speech of doctors when it comes to continuing medical education, which is a private enterprise, but they're kind of going into the private realms now and mandating speech. So that's the law I'm fighting now, and people can stay up to date with that on Twitter and on my podcast, and I've got the Substack, and I'm going to keep fighting for free speech and freedom.
So thank you so much. I very much enjoyed having Azadeh Khatibi on my show, and you can find her as mentioned. If you can spell her name, you can find her, and we very much appreciate her and her efforts. And you can learn probably a lot more than what we had in this show, but just following her Substack and so forth. So thank you, Azadeh, for being on our show.
Thank you so much, Dr. Bach. Such a pleasure to speak with you and to spread the message.
Thank you.